All right. So, thanks everybody for joining us, and to our M3s who were on, congratulations on nearly being seniors. And thanks for joining us in your interest in family medicine. I also want to thank all of our faculty and our staff who are joining us after what I'm sure was a busy day of clinic and hospital rounds. So I'm Jessica Bursk. I'm the program education manager for the family medicine department. And you all know Jennifer Van Echo very well. She is the overall lottery guru, but please feel free to reach out to me at any point during the lottery process or throughout the M4 year with questions about your family medicine schedule. I'm always happy to help. So let me see. I don't see Dr. Kelly on. He's our division director of student education for family medicine. I don't see him or Dr. Norris. So if they are able to join, we'll come back to them. So we also have our other faculty and staff from around the state at the regional site. So as we go on later in the meeting, we'll have time for them to introduce themselves. So for now, we're going to go ahead and get started. Are y'all able to see the slides? Okay. All right. So on the agenda for this meeting, we'll talk about our student housing options. Then I'll give a quick overview of each of the rotations. Then, as I mentioned, we'll have the faculty and staff introduce themselves and highlight anything that they would like you to know about their specific rotation sites. Then we'll open it up for questions and let the M4s give any pearls of wisdom they might want to give you about making schedules or how to arrange your M4 year. So much of the information that we're going to discuss is on our website, so I will put the link to our website in the chat so you can find that later. All right. So student housing, we do have free student housing at the locations listed here on the slide. Some of you may have already utilized the housing during your junior clerkship rotation or be using that coming up. So some of our locations have one bedroom apartments, others have a two-bedroom apartment. If you are in a location with a two-bedroom unit, you will have a bedroom to yourself, but you'll share the common area. And in most cases, you'll be sharing the apartment with another medical student, but in some cases, it may be a pharmacy or PA student, just depending on how busy the rotation is that particular month. Once the lottery is finalized, I'll reach out to each of you and ask if you need housing, and we'll get that arranged for you. So preference is given to students who are rotating at that given site. If the apartments aren't filled, we'll gladly accommodate students who are doing community rotations, and we'll talk more about those community rotations in just a bit. I do want to make a quick note that if your housing needs change, please let us know as soon as possible. Our coordinators put a lot of work into coordinating the housing, and there's often a student waiting list for that housing. So if you got any changes, just let us know as soon as you can. Right, so we'll get into our rotation options. To leave plenty of time for site introductions, I'm going to go through these pretty quickly. So first up, we've got our acting internship, and just as the rotation suggests, you're acting like a PGY1 or an intern resident. You'll rotate with the inpatient team. You'll get to write notes, call consults, return pages, participate in the procedures, and get to have a little bit of experience taking call. This rotation is available in the spring semester and it's open to all M4 students. So, our intensive acting internship rotation is the same type of experience as a regular AI, but this is reserved for our students who are applying to family medicine. So, any student that enrolls in this course is required to have a family medicine career advisor. The intensive AI is available in the fall semester, June through December. I would encourage y'all, if you're trying to get letters of recommendation, to go ahead and schedule those earlier on in the semester. Next is our family medicine primary care rotation, and this is an outpatient-based rotation at our UAMS clinics that have residency programs. You'll see full spectrum care, patients of all ages, preventative, chronic, and acute care visits. You'll also get to see procedures like joint injections, IUD placement, skin procedures, that sort of thing. And I would encourage you to take advantage of this rotation as an additional opportunity to see the residency programs you're interested in. A lot of students only take the AI because it's a required rotation. With this being an elective, not as many students take advantage, but it's an extra time to get to see the residency programs and for them to get to know you as well. All right. Next, we've got our private family practice rotation, which is another outpatient-based rotation. You'll rotate in the community with a private practice physician at our non-UAMS clinic locations. In most cases, there aren't any residents or other students, and you'll get a lot of one-on-one time with these physicians. You can choose to rotate in any area of the state. If you have a physician from your hometown or you've previously shadowed a physician, you're welcome to work with those. If you don't know any physicians, just let us know and where you want to rotate, and we'll give you some suggestions. The requirement is that these physicians that you rotate with be board certified. So just keep that in mind if you're requesting a particular physician, but we can verify that and help get all the paperwork in place. Once the lottery is finalized, we'll contact you and we'll find out where you want to rotate and help get that set up for you. And just of note, this rotation does not count toward your 12-hour rule. All right, rural primary care. This rotation, it's pretty similar to the private practice rotation, but we coordinate this in partnership with the community health centers and the Arkansas Rural Health Partnership. We have multiple locations around the state, and you can find that complete list in O2 and on our website. If you're particularly interested in underserved and rural patient populations, this is a great option. This is open to all M4 students. However, this is a required rotation for the honors and underserved primary care students. And then, as I mentioned earlier about the housing, if you are rotating in a site that's close to one of our UAMS student apartments, and we're happy to house you there. If our apartments are full, we do have grant funding for this particular rotation, and we can put you in a hotel. So don't let that be a reason for you not to take advantage of this rotation. Just let us know, and we'll get that set up. And then this rotation too does not count toward the 12-hour rule. Right. Next up, we've got sports medicine. Currently, this is only available in Texarkana. You may have talked to some of the upperclassmen that took this rotation in Fayetteville in the past. Right now, it's not available there. They're hoping to get that back up and running again. If that becomes available at any time during the year, we'll get a message out and let you all know. But Texarkana has a great option for this rotation. You'll see pediatric and adult patients in the outpatient clinic. You'll also be able to scrub in for OR cases. And then depending on the time of year, you'll be able to go to the local sporting events with the team doctor. All right. And our last clinical rotation is emergency medicine. This is available in Pine Bluff and Texarkana. We do require prior permission for this rotation just to make sure that we do have a preceptor available. So you can still put it on your schedule, and then I'll just verify that that block is available for you. So you'll rotate in the ER, often with our family medicine residents who are on their ER rotations. And you're welcome to also go to didactics and things like that with the residency program there. All right. So we've got two longitudinal course options, and the first is the Rural Family Medicine Behavioral Health rotation. This is a self-study course with modules that cover common behavioral health conditions that you're going to see in resource limited family medicine settings. And you can see some of the topics that are covered in those modules there on the slide. And after you've completed the modules at the end of the course, students meet with Dr. Norris, who is the course director, to review and give rotation feedback. And our last rotation is AHEC Scholars. Students complete modules through the Institute of Health Improvement and UAMS Learn on Demand, and then complete a 36-hour scholarly research project that then will be presented to our family medicine education team. One note, you must be enrolled in AHEC Scholars Program. This is something that you would have enrolled in either at the end of your M2 year or probably at the beginning of your M3 year. All right, so that wraps up our overview of rotations. Do we have any questions right now before we get into the site introductions? Oh, I see Dr. Norris is on. I know she has something that she has to get to. So, Dr. Norris, I'm going to let you introduce yourself and give any pearls of wisdom that you might want.
Can you see my face? I don't know if I'm on like my phone in my car. I don't know if
We,
anybody can see me.
yes, we can see you.
Okay. Hey everyone. I know a lot of you guys have seen me on some M3 rotations and I saw a couple of M4s on there. So, hi everyone. I'm one of the M4 site directors as well as kind of in charge of some of the curriculum development for M4s. So, excited that you guys are here and kind of listening about our rotations. We've got some really good information about these different sites for you guys. A little plug for the rural behavioral health self-study course. That's like a relatively new course that we've started, and I've gotten some good feedback from some other students. So if you're looking for like a longitudinal thing that you can do on like a month that you're doing a lot of that you're doing like a lot of interviews or something, that's a really good course and it kind of helps out. But yeah, so this is my face, this is who I am, and if you need any help or any advice about any of this stuff, I'm always happy to chat with you. Thanks.
Thanks, Dr. Norris. All right, so we'll go ahead and get into site introductions. First off, Batesville. Do we have anybody from Batesville on?
Jessica,
All
I
right.
got on Teams at first, and Dr. Roulier was still on there, as well as Dr. Walsh and a couple of students. But I saw you sent the Zoom link there, so
Okay. Okay. So that was visible to everybody.
I can start Batesville since we don't have any faculty on because I've done multiple rotations there if you want, or
All right.
I can also call Dr. Roulier. It's up to you.
Abby, if you want to just give a quick overview of how your rotations typically go, kind of like a typical day, that'd be great.
Yeah, so I actually just did my AI in Batesville not long ago. Batesville's pretty nice to you. You'll do mostly hospital, obviously, because it's an AI and that's what's required. It's going to be inpatient no matter where you go for the majority of it. I was lucky enough to get like maybe a half day clinic if they could work me in. So basically you'll show up to the hospital around 7 o'clock in the morning, which is much better than other services. So you'll show up at about 7. You'll get assigned patients for the day. They use Meditech at the hospital there, so you'll get Meditech clearance. You'll get assigned anywhere from like 2 to 4 patients, depending on your chief resident and everybody else there. And then you'll round on your patients. Depending on your attending, you'll do like ICU rounds 3 times a week at 8 a.m. Sometimes you round on your floor patients right after that. Sometimes you round at about 10 o'clock or so. I would say I was typically done rounding, depending on the attending and when they started, between like 12 and like 2, maybe 3 on a bad day. And then sometimes you'll write notes. Again, it's going to depend on your chief resident and your attending. Um, I would offer your help because sometimes the interns can get a little overwhelmed. So anything you can do to help them. And then you will attend on Wednesday afternoons, you go to their didactic sessions with all the residents. So you get relieved from your inpatient duties, one upper level stays, and then everybody else gets to leave and go to didactics.
Thanks, Abby. If Dr. Roulier joins, we'll go back to her. All right, next up we've got Dr. Clardy on here from Fort Smith.
Hello, we're currently kind of running two rotations right now. Our primary care selective that runs out of our clinic, where you have a lot of clinic time. And then we have our AI, which we're running in the hospital. We're doing 3 weeks on the medicine service and then 1 week on our mother baby service. We want you to have the opportunity to scrub into C-sections and participate in some deliveries and get a little more comfortable doing GYN exams for that. And then on our medicine service, we usually run like 6 a.m. to 5 p.m. I'm having our students do one short call a week on Thursday nights to 11, and then I'm giving them Friday afternoons off to compensate them for that. And then I'm reserving weekend time for if they need to make up any time away from the rotation so that we can make sure we get our minimum hours in. Um, let's see what else we can talk about on that. I've kind of revamped the rotation this last year. Dr. Norris has helped me out with a bunch with that. I liken it to trying to fix the airplane while it's in the air. So I'm constantly tinkering with stuff and tweaking it, trying to make it better. I've got a new coordinator, Ruby. She's on the call as well. She may have some other stuff to add as far as the functional parts of being here, but that's kind of most of it. Kind of try to get y'all to have 2 or 3 patients a day on the medicine service. I've got a Epic Note built for y'all to use. If you do come here, I would advise you to please make sure your residents do not copy and paste from your note. That's fraud with a capital F, and I don't want to go to Medicare jail. So, um, but otherwise, it gives you the opportunity to transition to residency training as far as learning how to document appropriately, and um, and hopefully that'll build up your confidence when you transition to residency. So that's most of it. Ruby, do you have anything to add?
Um, we hold didactics on Wednesdays afternoon
Oh,
from
yeah,
1
that's
to
a good
5.
point. Yeah, we do have didactic session that includes a skill session once a month. Usually we do something ultrasound or procedurally based during that skill session as well.
Students get free lunch as well.
Yep, everyone gets fed well at breakfast and lunch. And I think for the evening on the Thursday evening, I think they can have access to the cafeteria as well. So pretty much you can, if you're not careful, you'll gain about 10 pounds while you're up here. So
All right.
another big stuff.
Thanks, Dr. Clardy and Ruby. Okay. Next up, we've got Jonesboro. I think we've got Dr. Parnell and Michelle on with us.
Hey, so I am Michelle. I'm the coordinator for Jonesboro. And what I'll do is I will just say a couple of things, pretty much that Jessica has already said. We do have our apartments that are 2 bedroom, 3 bath. And we are just those apartments are just a couple of blocks from the hospital. So it's literally walking distance. Um, and they're fairly new apartments. Um, we do have the free meals here at Jonesboro, and um, you will get a couple of days in clinic. We usually try to schedule at least 2 days in the clinic while you're here. And I think that is it. Well, Dr. Chu, she is our site director. She is actually not on the call. She couldn't be here. But like Jessica says, I have Dr. Parnell with us, and he is a second year resident. So I'm going to let him tell you a little bit more about the rotation itself.
There we go. Yeah, so as for kind of what the AI looks like Michelle said, most of the times inpatient with a little bit of outpatient time. It's similar to some of the other day-to-days described. Usually students get in around 7 or so are assigned a few patients, usually about 2 to 3, and then we'll pre-round on them and round with the attending. Some prefer walk rounding, some prefer table rounding, just depends. We have an open ICU here. Usually we have 2 separate services, one carried by the first years with the third year supervising, the other one carried by second years. Um, so you could be on either service just depending on the day, but we usually have at least 1 or 2 per service in the ICU. So we help the intensivist manage those. So it's generally, Monday through Friday. We have our obstetrics, our labor and delivery floor here. And we also have an inpatient pediatric unit here. So we do our inpatient peds rotations kind of in our sister hospital, St. Bernard's. We usually try and get the AIs at least a few days worth of experience on those other services as well. I think that pretty much covers it. Unless there's anything else you want to add, Michelle or Stephanie, sorry.
No, Michelle's fine. It says Stephanie on all my emails, but Michelle is fine. Um, I think that is pretty much everything that I can think of. And I really appreciate you joining, Dr. Parnell.
Thanks to you both. All right. Next up, we've got Little Rock. Dr. Norris, do you want to talk about that, or do you want me to take that?
Yeah, I can talk about it. Um, Hi again, everyone. So, Little Rock, obviously on Little Rock's main campus, you'll be working with the Little Rock Family Medicine residency. The rotation is fully inpatient with maybe like 2 half days in the clinic. The rotation typical schedule is 6 a.m. to 6 p.m. You kind of the idea is you're mimicking exactly what an intern would do, right? So you're coming in at 6 a.m. for handoff and leaving at 6 p.m. at handoff as well. Expectations there, you're going to be holding the pager, you're going to be calling some consults. I've tried to tell the residents to let you guys do as much as they would let an intern do, just so you get like a true experience of what it is to be an acting intern. Um, Usually start off with 2 patients, build up to 3 or 4, depending on your comfort level. There are procedures on the inpatient unit. Right now, we are doing like one 24-hour call on a Saturday, and then you would have the following day off. Most of these rotations, guys, also you get at least a minimum of 4 days off a month, just kind of how like your upper levels would, or just like if you were a traditional intern. There are less perks. There's less free food. I am so sorry at Little Rock. You do get fed during lunch lecture like 3 days a week. And I believe also at like our morning report on Friday mornings. But yeah, I don't think there's as much free food. So there's some cool perks at some of the other locations. But so mainly kind of, traditional acting internship. We don't, because the family medicine doctors at our hospital do not run the SICU service or the newborn service or the OB service. It really is mainly just you getting to see what it looks like inpatient in Little Rock. Anything else, Jessica, that you want to add to that?
I think you covered everything. The only thing I can think to mention is that when you are on one of your half days in the outpatient clinic, you will get to spend some time in the procedures clinic. So just a little bit more of a chance to see some procedures. But yeah, Dr. Norris, you covered everything. Thank you. All right, up next, North Little Rock.
I don't know if you guys can see me or hear me.
We can.
My name's Zach Otis. I'm one of the attendings at the North Little Rock inpatient service. And so for our AI, we try and have the residents come over or the med students come over and act like residents. I think I saw a couple of the ladies that have already rotated with us this year, McKenna and Abby. So if you guys have any additional comments, please feel free to jump in. But we try and treat you like you're an intern. We have you write notes. We have you call consults. We have you go down and see patients with the intern and do H&Ps. We try and get you to put in some orders. You have to pen them, unfortunately, but just getting the act of being able to work with Epic is the EMR we use and practice putting in some orders is something that if you don't get to do until you're actually an intern, then it's a little rough those first couple of days, as any intern will probably tell you. We don't have any outpatient on our current setup, but I think one of our current interns, Ty, he did another rotation that you had mentioned, Jessica, where you can come in as a fourth year and be in the clinic. I think he did that last year to get some more exposure to our outpatient setting. But yeah, we have open ICU, and so we're often carrying a couple of patients on each team that are critical care, and so pretty full spectrum. There's not a specialty that I can think of other than like derm, off the top of my head, that we don't have available at our hospital. So pretty good coverage, and I think that so far a lot of the med students have really enjoyed their time from what I've been told. So if you guys have any questions, don't hesitate to ask.
Thanks, Dr. Otis. I know you're technically off today, so appreciate you taking time to join us. All
No
right, Pine
problem.
Bluff. Up next, we've got Pine Bluff. I know we've
Hi,
got Cynthia on. Go ahead.
I'm Cynthia. I'm the student coordinator here in Pine Bluff. Here we have the hospital is across the street from where we're located. in between the hospital, we have like a JRMC has a wellness center. So if you're interested in the wellness center, you're free to use a wellness center. Our apartments are within walking distance, so there are two-bedroom apartments as well. And I have Zach on here. He's going to talk about his experience here. Not Zach, I'm sorry. Noah. Noah, are you here?
Yes, ma'am, I'm here. Can
Okay.
you guys hear me?
We
Yeah.
can.
Wonderful. I'm so sorry about my camera. It was not wanting to work with me today, but I'm Noah Wood. I'm one of the fourth year med students that just got off my AI while I was in Pine Bluff. And just to tell everyone a little bit about what we did, I was in the clinic. They have two little pods right next to each other, and you can choose either side. I was there with another fourth year student who's on his AI and two other third years. And we kind of split the pods up and we just followed the residents around. And the first few days following the residents, and then afterwards, once we're comfortable taking up our own patients, doing so, and to our own comfort level, doing whatever else they would like us to do. So putting in orders or doing or helping out in procedures that may come up throughout the day. After morning clinic, you would go to the every day they had didactic sessions upstairs, and they provided food for you, which was very awesome for them to provide that for us as well. You'd sit right next to your residents that you worked with, so it was close. Um, you get to work close with the residents while you're there as well. And then after afternoon clinic, you're free to go home around 5 or 6 o'clock. It was a really wonderful experience. What I would like to say also is that they're very accommodating to people who are in emergency medicine, if that's what your interest is. I did exclaim that I was going into emergency medicine, and many of the attendings there would cross cover the ER. So I'd follow them over to the ER, or they would let me take one of the clinic half days, like either in the morning or the afternoon, to go over to the ER and shadow their physicians over there as well, which is a very wonderful experience as well.
Thanks, Noah and Cynthia.
Thank you.
All right. Next up, we've got Springdale, Fayetteville. Do we have anybody on from that site? Okay. If anybody,
Well, I could represent, I suppose.
thanks, Dr. Brimberry.
Yeah, so I'm here maybe serving dual roles, but Fayetteville and Springdale have been part of the Northwest experience. And up here, we have two clinics. One is in Fayetteville and one is in Springdale. The clinic in Springdale has moved recently to what is the facility called the Schmeeding Center. So we're no longer directly attached to the hospital in Springdale, but it's not far away. So it's a little harder to get food for our students, although there's plenty of good places to eat nearby. And food is free at both of our hospitals for any students rotating on any rotations up here. We, as you can see, we do the intensive acting internship, and the primary care clerkship and senior rotations, I guess. But we have a lot of longitudinal students up at Northwest as well, and so I find myself asking some of our students, "Are you one of our longitudinal students? Or are you from Little Rock?" Because I haven't, especially at the first year, we don't know everybody, but we take all comers. We've been doing it a long time. Washington Regional is actually the hospital that we use most frequently for our student rotations in the AIs. And that's because the Northwest Health System in Springdale is a little harder to get students onboarded into for like a 4 week block experience. But regional is easier to do that with. And it's a very, very busy inpatient service. And you work alongside the other residents and interns as part of the team with our attending physicians. The primary care rotation, and of course the selective or the clerkship, we all know how that runs at all of our sites. I had a question, by the way, when we were talking about Little Rock. Do the clerkships students do clerkships in Little Rock now, or is it all out in the regional programs?
So we do have clerkships in Little Rock as well as the senior rotations.
Okay, so I
Yes,
just
sir.
assumed, we weren't. I didn't know that since you weren't talking specifically about the clerkship. But anyway, we enjoy having our students here. We have them in our clinics, both clinics frequently uh, paired with both faculty and residents, depending on the day and the experience. And I think everyone who comes um, has a good experience up here.
Thanks, Dr. Brimberry. We'll be coming back to you shortly to talk about Berryville and Eureka.
All right.
All right, next up, we've got Texarkana.
Woo, okay. Yeah, I'm impatiently. No, I'm joking. Okay. Bear with me. I got a few bullet points I'm trying to hit. Dr. Diaz, last minute, he had to travel somewhere else, so he was not able to join. So I'm trying to talk for him and myself. I'm Jalecia Lewis. I'm the student coordinator for UAMS Southwest here in Texarkana, the Arkansas side. We do have the Texas side of town as well. The housing and the hospitals are on the Texas side of town, and the clinic is on the Arkansas side of town. We are in the southwest corner of the state, next to Texas, close to Louisiana. So Texarkana, the Texarkana metro area is big enough to offer plenty of activities and a good quality of life, without being in all that, spending all that time in traffic and stuff like that. Dr. Diaz just wanted me to know that our main hospital is Trista St. Michael's. They did buy out Watley, so we do have a St. Michael's Pine Street, which is the old Watley. That St. Michael's get pretty busy this time of the year. About a year ago, they had like 50,000 ER encounters. They do all type of procedures in the hospital, intubation, centralized things, if that's what interests you. We do have one university and two community college. One being the University of Arkansas Hope Texarkana, which is right next door. And oftentimes they have different events that they host and they invite us to. It just all depends on what time of the year you're rotating. Um, if you're doing the AI, I have my past student Kayla on, and I'll let her speak about her experience here in just a second. But she was the first student. She came and did the intensive AI, and she was able to come into the clinic a half day out of the week each week when she was here. So she really enjoyed that, but I'll let her speak about that here in just a second. As Jessica said, we are the only ones currently offering the sports med rotation, and Dr. Mitchell, he absolutely loves having students. You'll also get to work with a physical therapist, and they typically have surgeries on Thursdays. The St. Michael's physicians, they are very welcoming. They are approachable. They invite you to have a conversation with them, pick their brain, ask any questions you have. You also get to eat free at that hospital. You can use the main line, or you also have the physician's dining. The physician's dining is off in a separate area and it's a little more top notch than the cafeteria food. Although the cafeteria food is really yummy, students like to utilize the physician's dining area. In a clinic, they do procedures, joint skin, including nail removal, multiple gynecology procedures. We do have two clinics, morning and afternoon, morning starting at 8 and afternoon starting at 1. Every Thursday we have didactics, and then every other Wednesday we do have grand rounds. And so you'll go into if you came and did family medicine primary care, you'll be here all week and you'll go in and you'll do your clinic that morning, noon, you'll go in for grand rounds. They also have free food at grand rounds. Yay. And then you'll go in the afternoon and go back to clinic. We do also have a school-based health center and rural community clinic here in Falk, which is about 20 minutes away from us. So yeah, again, if you were here doing the family medicine primary care, we can get that set up to where you can go out, depending on who's attending out there working. Just reiterate on our housing. Our housing is located in a quiet neighborhood, 2 bed, 2 bath. You may or may not have a roommate. If I can help it, I try to house you all separately, but that's not always the case. Our apartments are not a part of a complex. And then there's also several dining options located around that area. The housing is only about 5 minutes away from the hospital and only about less than 10 minutes away from the actual clinic. I think I've talked long enough. I think I've hit most of the points that I wanted to hit. I'm going to let Kayla speak about her experience. I had the pleasure of having Kayla here as her during her M3 year as well, and then she came back and did her intensive AI. So Kayla, I'm gonna let you take it over from here.
Hey, I'm Kayla. So like Jalecia was saying, I did my third-year rotation there, then also my acting internship. So for that acting internship, I was inpatient during the week, and then I would do a half day of clinic every week. So it's nice to get kind of both experiences. There are two inpatient teams, but everybody is in the same workroom. So you'll get to like be part of the team, but you'll like mainly be on one of the teams. Would get there at 7 every morning, where the night team would sign out and the attendings would also be there at 7. So I thought that was kind of neat to have like a full team meeting in the mornings. And then I could see like as many patients as I wanted to in the mornings for pre-rounds, and then we would do like walking rounds, lunch, and then whatever like admissions there were in the afternoon. And so some days like I left like earlier in the afternoon, and other times I stayed till 6 for the nighttime sign out, just depending on what the day looked like. And then they have two nights you can do like overnight call and see like admissions overnight. And the team room is like in the physician's lounge, so like it was really easy to like just get there close to 7 and grab breakfast, get lunch after rounds, which was nice. And all the faculty and like staff and residents are great, so like you'll be well taken care of.
Thanks, ladies. And Jalicia, thank you for waiting so patiently for your turn. We have so many great rotation opportunities. We're going to get to everybody. All right. So next up, we're going to go to our rural training residency sites. And so Dr. Broomberry is back up to talk about Berryville and Eureka Springs.
Yeah, I don't think my associate program director got to jump on the meeting, Dr. Fawcett, but we're, of course, a relatively new program. These two communities are up in Carroll County. Most folks are probably familiar with Eureka Springs because of the tourism nature of that community, that small community of about 2,300 people, very quaint town. And then, of course, Berryville is a little bigger, about 6,000, and just a classic rural Arkansas town, pretty vibrant community. Our our residency has just started, so through the years, I think there's probably been some students that have come up to the Mercy Clinic in Berryville and or the Washington Regional Clinic at Eureka Springs and done some of these rural care, rural rotations or rural preceptorships in their first or second year. But we're pretty much newbies when it comes to having seniors come up, juniors or seniors. So we just had, in fact, the first time we had a student was just recently. We had an NYIT student come over, and we learned some things about how to host. But her, in terms of housing, her parents lived nearby on Beaver Lake, so she was able to stay with her parents. We do have some housing available for residents, and I think if it were appropriate, there could be room in one of their houses to have a bedroom to stay at for a while. We don't know that for sure, but that would be an issue in terms of figuring out rotations for students who would be interested in coming up here and learning what it's like to work in rural practices. So most of the experience would be the rural primary care. It would be in the Mercy Clinic more than likely. I don't think Eureka Springs has been involved yet, but it's primarily in the clinic working with faculty. I didn't ask Dr. Fawcett whether he had the student work with our residents or not. They may have, but I don't know. And then Dr. Fawcett does a lot of wound care, which is a outpatient experience that he does and teaches in. And he does that over in the hospital setting. And he had our student going over there with him at least all day on some of the time there on Tuesdays, and had them be involved in wound care, procedural care. I don't believe we did any inpatient for our students up there. And there's no maternity services in our critical access hospital. So it's mostly an outpatient experience, but it gives you a good flavor of what it's like working in a rural small town practice.
Thanks, Dr. Brimberry. All right, up next we've got CrossFit, and I believe Dr. Walsh is on with us.
Got myself and Dr. Clark with us. Dr.
Oh,
Clark.
there's Dr. Clark. I'm sorry, I wasn't looking, didn't look over on my other screen.
I'll
Thanks for
let Dr.
joining
Clark
us.
take it away and I'll fill in afterwards.
Okay. Yeah, so hi everybody. I'm the newest faculty member to be added to the CrossFit program, so that's why I wanted Dr. Walsh to help back me up. So anyway, so CrossFit, we primarily focus on the outpatient experience. We do try to let students have some experience on our inpatient service, usually along with a resident, with our hospitalists as well as the ER. Try to do that in like a day here or there to they get the full gamut of the full experience. But we're really primarily about that outpatient experience, and especially in a rural practice. So our students come in, get started with us at 8 o'clock in the morning. They'll spend time with all of our faculty and our residents. We currently have 3 residents on the ground, second-year residents. They spend time with me, Dr. Walsh, Dr. Ben Walsh, and really kind of get a good experience of what a rural primary care can be. We do lots of procedures in clinic, just anything that kind of walks in. And we have a full radiology like suite. We have x-ray in the clinic as well as labs. So we oftentimes can get lab work there in the clinic. So you can get experience interpreting labs right then and there. As well as a little bit of microscopy. We do, old-fashioned urine microscopy and things like that as well in clinic, as well as interpreting x-rays. And then I mentioned we do lots of procedures as well. And that's kind of our focus. I know for lodging our students, we've had them stay at the hotel. There's also a really nice place that just opened up called the Trishman House that we've lodged people in. Really nice old house that's been kind of refurbished. And I believe there's another B&B used as well. I'm not as familiar with that one.
Yeah, so as a rural location, and Jessica, you can correct us if we're wrong here, and this may apply for Berryville as well, like we're able to access some grant funding for housing. And so in the past, we've utilized that for folks that are going to stay local, and we'll put them up in an Airbnb for the month, that kind of thing. So generally, there's a solution to the housing. Even though we don't have maybe dedicated apartments here, we have a solution to that. And generally, everybody's been happy with where they've stayed. I will throw in, like Dr. Clark mentioned, we spend time in the outpatient environment, but also in the hospital doing inpatient and ER. We have a wound care clinic as well in the hospital, and generally you'll spend a couple of days over there with Dr. Prather, just kind of picking up some skills there. Trying to see what else I'm forgetting here.
Didactics every day at lunch.
Every day at lunch.
Free food. Gotta love free food.
Yeah, everybody eats free at the hospital. Generally a pretty slow pace of life in Southeast Arkansas. And so it's kind of a relaxing time. When you're outside of work, you can kind of take time to relax and get out in nature a little bit and see some new sights. We're about 7 miles from Louisiana. So if you're interested in any crawfish or Louisiana fare, you're in a good spot for that. So
by procedures, they mean up to and including perirectal abscesses too. So.
Oh yeah. Brian spent a month with us, so he got some experience. Also sutured up a finger very nicely.
Brian, if
Excellent.
throw in there, please do.
No, it's very one-on-one with the attendings, especially because right now they have like half as many residents as they will have next year, I guess. So very one-on-one with attendings, which is something that's hard to get at a lot of the other sites and everything. So really nice.
Dr. Clark and Walsh, thank you very much. And as Dr. Walsh did mention, we do have those grant funds for this rotation. So Berryville, Eureka, Crossit. We're going to talk about El Dorado next. Dr. Childs will be up. We do have other locations around the state for this rotation, but I just wanted to be sure that y'all got to meet the faculty at these sites. And with that, we'll go ahead and turn it over to Dr. Childs.
All right, you talked about meeting faculty. I feel like I should have Danya Watson's head to show you. She's kind of the person who is starting at the program down here. She teaches a lot of obstetrics. So she is about, I don't know, 30 years just doing OB, but family medicine OB. So she doesn't work in my clinic, but she does want to invite you over to the women's clinic there and invite you to do deliveries if you are interested in that. But you're welcome to spend time with me and Dr. Martha Garrett Schaefer and Dr. Ciaja James, our first obstetric fellow here in the clinic where we see full spectrum family medicine. We have good hospital food. I don't know if it's free, but you know, we'll figure these things out as we go along. So we're really looking for people who want to be self-motivated learners. I've been teaching for quite a few years, so I think that I can offer you something there. And I have to do my procedures within the course of my day because I have not been allotted things like procedure clinics and that kind of stuff yet. So we'll just kind of keep moving and see lots of stuff. And if you want to follow any of the specialists being connected with UAMS, we do have like transplant comes down and ortho sports and some cardiologists and stuff like that. So if you wanted to get a different experience with some of those people while you're here, you can. I also have working relationships with the surgeons and the doctors in the ER. So if you want to dabble in seeing what all those things look like, we can set that up for you. Give us maybe a week heads up before you show up and we'll get it set up.
Thanks, Dr. Childs. All right, so that is all of our sites, but I do want to circle back to Batesville. Dr. Roulier joined us. Abby did a fantastic job promoting Batesville, but I just want to give Dr. Roulier a chance to introduce herself and add anything that she might want to.
Hi, I am very sorry. I was on the wrong place. I admit to being very, very bad with the internet or anything. But I have no doubt that Abby promoted us. So I probably don't have a whole lot more to say, but we do try to give you a full experience of what you would want. So if you come and so we actually have people who stay in the clinic. That's what they want to do. We have people who want to do an AI at the hospital, but that always includes at least a half day. And then earlier in the year, we have 2 third-year residents who are rotating, so we have you kind of follow with a third year. And the only other difference I would think is that we actually do weekly rotations. It's called the Clinic First model. So our residents rotate weekly in the hospital, and they rotate weekly they have their clinic every week, but there may be days where they have more clinics. So you actually, if you are a 4th-year student, you actually will, by the end of a month, will know the patients probably better than most of the interns that are coming in because you also are the continuity of care. So we also rotate with the hospitalists at the hospital who are mostly young, to tell you the truth. And I think actually a lot of people have liked working with them. Next year, one of our graduates will be one of our hospitalists. So we will have 2 family medicine hospitalists. We started off our program that way. But there's also the opportunity to come and work in the clinic in sort of rural. Our town is 10,000 people. We do have a couple of restaurants. We only feed people 1 day a week, sorry. But we have an Aldi's. And I tell people to bring Trader Joe's up. I have a freezer if you need some extra space. So those are the things I miss. I moved here 25 years ago from New York. So, but it's a good small town. We do a lot. You do the things you can. So as far as promoting the town or the city, I think residents try and get together afterwards. So, and always include, especially the 4th-year students. And Abby and other people I see on here have been here, so you can talk to them.
Thanks, Dr. Roulier. All right, so I want to open it up for questions. I see that we got some M3s on, so please feel free to speak up and ask questions, either of our faculty and coordinators or the M4s that are on. Or M4s, if you want to give any pearls of wisdom or tell our M3s the things they don't know to ask about M4 year, please go ahead.
Okay, I have something not rotation related per se, but family med related. So, um, go to Future in the summer. It's the national conference. Highly recommend going. Jessica is awesome and she will send out information about it and scholarship opportunities and stuff. Um, but this summer it was me, other Abby, McKenna, and then one of our other friends, Kara. And then who else went? Nathan. Nathan Bowers wound up going as well. Brian ditched us last minute. Um, but we had a really good time. You get to meet like 600 residency programs. You do a lot of workshops. It's really good networking and it's just super fun. It's in Kansas City. So definitely go to that.
I would just say, just in general, you're going to have a lot of flexibility in what you schedule fourth year. It can be very tempting to put everything off to the last second if you're like me. Um, but looking back now, I really wish I would have done more in first semester, like the first semester. So that way, if you have anything come up, you have to take time off and you can. Um, and that way, whenever you're about at this point in time, whenever you're getting interviews over with and stuff, you're not scrounging around for rotations and stuff to get finished. So just in general.
And you will need 3 letters. So, like Brian said, it's good to get those rotations done early. Um, if you go to Baptist North Little Rock and work with Dr. Otis, who is an angel, he will write you one in September last minute. Um, but not everyone is so willing. So make sure you get rotations done early so you can get letters. I also did Dr. Norris's rural behavioral health course this past semester. It was a great course. I think everybody should take it if you're doing family med. So if y'all have any questions about any of that, let me know.
A course that Abby and I are on right now is the EKG course with Dr. Padak. And you may not think that you're a cardiologist, but EKGs are a very big part of family medicine. And so, highly recommend taking that course. He's a great doctor, he's a great guy, he's hilarious. So, that'll just be like a very beneficial course to take for once you get into residency.
Mhm. Any questions from our M3s?
I don't have a question, but I just wanted to say thank you all for your time and, advice and everything.
Absolutely. Thanks for joining us. So if anybody needs to get to other commitments for the evening, get some dinner after a long day, please feel free to go ahead and leave the meeting. But I will hang out. If any of the students or faculty want to hang out, we will to answer any questions. Here's my contact information. Feel free, again, like I said, at any time during lottery or throughout the year, please email me, and I'll be happy to work with you on your schedule. Thanks again, everybody, for joining us. All right. I think all of our M3s are gone. So thanks, y'all. Appreciate y'all being here.
Bye.